There is an urgent need to reduce the number of zero-dose children in Nigeria by 15% in 2024 and 80% by the end of 2028. And this was a submission made by the Paediatric Association of Nigeria at this 55th Scientific Conference in Lagos. Key stakeholders in Nigeria's health sector present at the event made a general consensus to take urgent actions in improving vaccine coverage across the country. News Central's Omolola Ololade completes this report.
According to the World Health Organization and UNICEF, Nigeria accounts for about 6.2 million zero-dose children, and it is one of the 6 countries that account for half of all zero-dose children globally. To reach these children with life-saving vaccines, especially for those in rural areas, the Paediatric Association of Nigeria, at its 55th annual scientific conference, emphasized the need to start taking urgent actions. Themed beyond strategies and goals, reaching every Nigerian child with optimal care, pediatricians in Nigeria believe it is time to go beyond talk and create a productive avenue to identify high-impact, low-cost policies and implementation strategies to providing every child in Nigeria with optimal care.
Just like in many other things, there will remain that core number of children that are so hard to reach. So we are trying to reach these children, and that's why we're having this conference to answer the question, what else can we do to ensure that every child, irrespective of their location, irrespective of whatever factors we want to consider, gets health care. We want to ensure that every child is a name, not just a number. So that's why we're having this conference. I hope that by the end of this conference, we'll be able to come up with pragmatic solutions as to what to do.
If we're talking about zero-dose children, we want to ensure that our policies will ensure that those children get immunized. We're not just talking about the numbers. We want that number to be reduced to 0. So we want to move from zero-dose children to children who have received vaccinations, and we don't want to talk about that anymore. At any time a child visits any primary care center or any health center, that child's immunization status is updated, and if there are vaccines that they miss, an opportunity is created for the child to get that vaccine immediately.
However, the fallout of zero-dose children is the high mortality rate in the country, hence the call on the government by key health stakeholders to take a holistic approach in providing lasting solutions to reduce the indices drastically.
We know there's a lot of equity issues in the country, and it needs to be tackled from many different areas. So we talk about the health sector, which is one part, but I believe we also need to look broader to include education, nutrition, child protection. There's a multifaceted approach that needs to be taken to make sure that the numbers are reduced and also in a sustainable way.
Experts in the Nigerian health sector, however, believe improving vaccination coverage across the country can be achieved if there is proper monitoring activities at all levels, particularly in the state, local government areas and wards. This can in turn bring Nigeria back on track in achieving the target for WHO's immunization agenda for 2030. In Lagos for News Central, Omolola Ololade.